It adds up. The doctor licensing, the amount you pay for renewal keeps going up. For renewal of your license, you need so many hours of continuing medical education. This does not make you expert in your field, but it makes you run after the test and take it just to produce a written paper certificate so that your privileges at where the workplace as well as with the insurance company are continued. There is inefficient compensation models. Physicians sign contract that you will accept 60 cents to $1, and you will not bill the patient. You, by your profession, you see people who are not able to meet their daily expenses at home. So they are not able to pay physician fees. So how can you press them to pay? Computerization and loss of autonomy. Computer is an artificial intelligence. What you put in, you get that. It doesn't have brain of its own. Physician burnout results for spending more time on the screen. I would say screen time disorder. It does make people irritable, short focus, neck strain, and causes insomnia, lack of sleep. Electronic health records enhances your physician unwellness, and it trickles down to the personal life where unrecognized symptoms may appear, which could be skin eruptions like acne breakdown, headaches, lower back pain, frequent sickness, and other disorders like gastrointestinal and muscle aches and pains. 21% of physicians furloughed during COVID-19 and their pays were cut. Other symptoms of being unwell or burnt out is very visible sometimes, with being anxious and anxiety and being tired, forgetful. And it does affect the mental health. Person may become suicidal, drug dependent, and depressed. Become lonely due to long hours of work, have no hobbies, poor attention, and patient care results in family breakdown. Male and female physician affected by exhaustion and burnout is suicide. It is highest in female physician than any other profession where female works. There are domestic relationship difficulties with family, children, parents, and friends. There's no age range. Younger residents, they get affected by long hours. Middle-aged, young people, older physicians, they're all affected. There are career difficulties, getting the job or keeping the job or advancing in the job. They tend to go to poisoning themselves or firearm or firearms or asphyxiation. We got to find the solutions. In 2000, 57% of doctors were independent, but this decreased in the next 16 years to 33%. There was increase in the physician who were just employed rather than independent practice. They worked on a salary. People were having hard time to find a provider. Doctors stopped seeing Medicare and Medicaid patients. On the average, physicians in the US work 55 hours each week, earn about $270,000. This is for pediatrics, family practice, internal medicine, in that range. Anesthesiologists, surgeons, and other specialties make higher amounts. All the work hours and compensation vary by specialty. 25% of physicians work more than 60 hours per week. Does not leave much to spare at home. We need an action plan. Healthcare system must develop best practice, EHR design. Has to be different than what we have now. We must implement to optimize patient advocacy and care. Accurate estimate of burnout prevalence among physicians would have important health policy implication. But overall prevalence is unknown. This is through media search that I have found that there is no such number available. There are several screening tools, including Mayo Clinic screening tool, that will tell you what percentage of physicians are having burnout, anywhere from 43 to 46%. But how do you measure it? There is a lot of variability in these estimates. We don't have a definite definition or assessment method. We need to develop a tool for the definition of burnout. Is it unwell physician? Or can you make them well? The risks are variable in different specialties, as I have mentioned before. It goes along with their number of hours. Anesthesiologists and psychiatrists, general practitioner, and general surgeons at a higher risk. There were 1% of suicide attempts and 17% of suicidal ideation in physician. Insufficient data precluded meta-analysis on other healthcare workers like nurse practitioners, nurses, and paramedics. There are mental, social, and physical implications we need to study. Evaluation tools, as I mentioned, should be used. One of the tools is Maslach Burnout Inventory to assess the burnout.